Hello, everyone. My name is Dr. Ngozi Onoha. I'm a physician and health educator. Welcome to Health for Naija podcast. This is a blended podcast because we have a broad range of topics from health to inspiration to finance to education to knowledge, all geared towards improving ourselves and adding value. Today's program is sponsored by Gift of Life Donor Program. The content discussed today is applicable to people living in the United States of America. Our viewers all over the world may still obtain valuable insight from listening to our discussion today. So let's begin. Today, my guest is Leslie Jean Mary. She is a multicultural affairs specialist at Gift of Life Donor Program. We're going to talk about the importance of organ and tissue donation. Especially this month, August, is National Minority Donor Awareness Month. The goal of this annual observance is to increase organ donation registrations amongst communities of color, which make up nearly 60% of the more than 100,000 people on the national wait list for life-saving organ transplant, and promote healthy living and disease prevention to decrease the need for transplantation. So I'm very happy to welcome Leslie. Welcome. Thanks for joining me today, Leslie.
Thank you for having me, Dr. Anoha. I really appreciate you having us on your platform today.
Welcome. So tell me a little bit more about your program, and let us really, just for the benefit of viewers who don't know anything about or don't know as much as they should about transplant and your transplant program. Tell us a little bit more.
Absolutely. So the Gift of Life Donor Program is what is called a OPO, or an organ procurement organization. And there are over 55 organ procurement organizations in the United States. And at the Gift of Life, we particularly cover the eastern part of Pennsylvania, South Jersey, and the state of Delaware. And so what we do is that we help procure organs to save lives. Particular organs that we procure are heart, kidneys, intestines, lungs, pancreas, and we also procure tissue like cornea for the eyes, bone, and skin for skin grafts. And typically, this is always done at a transplant center, which is a hospital in the area, with surgeons and nurses and our clinical staff.
That's amazing. I visited your website, which is at donors1.org, and I see you do a lot in Philadelphia, the Delaware Valley area, Philadelphia, Jersey, Delaware, to facilitate transplant for those that need it. And it was also, for me, very fascinating because when I was researching this topic, I found out that the first tissue transplant occurred in 1905. This was a corneal transplant. Mm-hmm. So that was really fascinating for me to learn. And also, I found out that the first living kidney donation occurred between a set of twins, and this occurred in 1954. And kidney, the reason a lot of people talk, when they say transplant, a lot of people think of kidney because kidney is the most common living donor transplant. Am I correct?
Yes. In addition to the kidneys, also a section of your liver can be transplanted if you are a living donor as well, because the liver actually regenerates itself. So for example, I have an ambassador who donated 60% of his liver to his father.
Wow.
But then his liver regenerated itself to its full capacity again.
That's amazing. I think with the technological and the medical advances, I think medicine has really pivoted where it's just incredible that this sort of service is available, and the fact that your organization is here to coordinate, to facilitate, because like you said, over 60,000 people of color in the area are on this wait list for organ transplant. So why is this? Why do you think, this number is so high, and what is your organization doing to raise awareness?
Yes. So for communities of color, the specific reasons go towards our health, that we are 2 to 3 times more likely to suffer from high blood pressure, for example, and also diabetes and other diseases that cause, and we'll talk in this instance, kidney failure. And so what we do and what all the organ procurement organizations do is not only do we promote the importance of organ and tissue donation, but we also promote taking care of yourself as well. Love yourself, take care of yourself. So you could possibly avoid this. And the other part of it is, if you are a registered organ donor and you're in good health, then possibly your organs can be suitable for, a successful transplantation if that time came.
So you touched on a very important topic, which is what I really focus on is prevention of disease. As they say, an ounce of prevention is better than a pound of cure. And you mentioned that some of the most common conditions that cause kidney failure include hypertension and diabetes. And so preventing these illnesses, or if they occur, controlling them really goes a long way to ensuring that organs do not start to fail. Because when kidneys fail, then 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 replacement therapy becomes the next best option, which is in the form of dialysis. And as we know, somebody on dialysis has to have dialysis 3 times a week, because you're basically using the dialysis machine as sort of a kidney replacement. And so you have a lot of people on dialysis, and a lot of them are waiting for kidney transplant, and the wait list can be years.
Yes, the wait list can be up to 8 years for a kidney. And it really does depend on what you're doing while you're waiting. Are you following your specialist recommendations? Are you, going to doctor's appointments? And again, as we speak about kidneys, are you going to dialysis as instructed? Do you have a support system? Do you have someone who will be there for you, like a caretaker, to make sure that you are ready when that call does come? The waiting list is long, because there's so many people who are waiting, but there's not enough organs to go around, and that's why in my field and what we do in public affairs is that we have conversations like you and I are having tonight about, organ and tissue donation. We talk about, addressing concerns or misconceptions that people may have about being a registered organ donor. And I always say when I'm out and about that being a registered organ donor is just you signing up to be an organ donor. It doesn't necessarily mean that you will become an organ donor, but just to register, it just takes 30 seconds. And it's just something that we always say, it's just a fundamental human right for you to pass on what you possibly could to the next person whose life will need your organs should you pass away.
So registration means when you go to get your driver's license, you can opt in, or you can sign up online.
Yes.
Okay. And what is the
Exactly.
link for signing up?
So for our region, you can go to our website, which is donors, DONORS, the number one.org, or you can also visit donatelife.net and learn, or donatelife.org to learn more. Because another thing I always talk about when I'm out in the community is that we want everyone to understand what they're doing. So that's why we provide a lot of education, why we address concerns that folks may have, address misconceptions about being an organ donor, and really just make sure everyone has an educated information and knowledge before they say yes. We always like to have our ambassadors, on board with us. And as I shared with you earlier, we did have someone scheduled for this evening who was actually waiting for over 5 years. And he just received a kidney transplant. So he's actually recovering.
That's wonderful news. When you sent me the email to say that, because I was expecting that he would be on here to tell us about his experience.
Yes.
And then you sent an email to say that he won't be attending because he got, off the list and he got a kidney transplant. I was really excited for him.
Yes, it's just, it was really, exciting news. And, again, proving two things. One, he waited for over 5 years, so the waiting list is long, but he did get a kidney and he's recovering very well.
I'm so glad.
Yeah.
So here in America, the rules around living donor, because there are two, from what I've researched, there are two ways by which organs get donated. One is the deceased donor. So, and then the second is the living donor. And for the living donor in America here, the living donors, they're not paid. It is
Right.
something they do voluntarily.
Right.
So there's no form of monetary exchange or any kind of promise for anything, any reward. There's no reward. It's something people do voluntarily. And it's interesting because I was watching this YouTube video of a mayor, I think a mayor of Connecticut, who actually, he gave a TED talk and he donated a kidney to a young girl.
Mm-hmm.
That was incredible. And when they met before this organ donation happened, she brought him some flowers as a thank you.
Yes.
But there was
Yes.
no money exchanged.
Yes,
And yeah.
there is no money exchange. That is against federal guidelines here in the States. When a living donor actually donates, a lot of times it's within the family. However, once a lot of people hear someone's story, about them suffering, and again, we'll use a kidney for example, they become what we call altruistic donors, where they will go to the hospital, go see a specialist, and do the required tests to see if they are a match for this person. And so that happens a lot. There are a lot of altruistic donors, but also too, there are a lot of donors within the family because of the match of blood and tissue and things of that nature. We at Gift of Life, we specialize only in deceased donation. However, we are very much, aware, and we also talk about, the importance of living donation as well.
Okay. And the deceased donation, it occurs if someone is brain dead on the vent. And that is
Yes.
typically how it's set up, and they've already registered as a donor. And typically somebody registers as a donor, they're encouraged to tell their family that they've registered as a donor. And this is to avoid, family being upset if they hear that, oh, a loved one registered as a donor and did not tell us. So that is a very important conversation to have.
It is a very important conversation to have. When someone registers in the States to become an organ donor, that is a legal document. And we always say that you must, have this conversation with your loved ones, because as you said, Dr. Onaha, when when someone doesn't know and they are approached at the hospital to say, did you know that your loved one was an organ donor? You know, most times the wish of their loved one is respected. But then there are times where a family or friends or a close person could be kind of really blindsided because their loved one didn't have that conversation.
Right.
So we have our clinical experts to sit down with the family and go through it, the whole process of what it means to be an organ donor, why their loved one made this decision. And it's also very important to note that we also have therapists, grief therapists, on our staff to talk with those families. And we call those families donor families. We call those families donor families, and they are involved in our meetings that we have for those families called Heart of Gold. So these families are together, they work with, each other, they work with us, they tell their stories as well, because of course there's the other side of the story. And you cannot, in many cases, receive an organ if you don't have someone registered being an organ donor and then a loved one actually, being okay with it, making that decision. And, for a lot of families, they feel, validated, right? They feel like their loved one has made a huge, give back to human, and that they are really grateful for that. We have people who feel like their loved one goes on, if you will,
Right, right.
and made that last, selfless act to become an organ donor to save someone's life.
Yeah, I mean, if you read the stories and you go online, you'll hear a lot of people talk about their experiences being organ recipients, and they are very moving stories. And even for those donors, the families of the donors too, though, you get to listen to a lot of very moving and touching stories. So
Yes.
I think, in America, in terms of organ transplantation, I was very fascinated to see how far they've gone. I know when the first kidney transplant occurred in 1954, because it occurred between two brothers, they were twins, and I think one had bad kidneys and the other didn't. And the good thing about it was they didn't need to, the recipient of the transplant did not need to take rejection medications, because people who've received organ transplant, they have to take anti-rejection medications, and those can be quite costly. So it's a lot. I was just going to put in, just for the sake of completion, that if there's a living just if there's a living donor, if they've expressed a desire to donate a kidney, they're usually assessed very thoroughly in terms of psychological evaluation to determine what the motive is for the donation, their capacity for decision making, any history of mental health or substance use, their family history, kidney function, the blood group, histocompatibility assessment, infection screen, cancer screen. So it is very, very thorough. And in fact, the surgeon who performs the transplant is not involved in any of this decision making, just to remove the possibility of bias. So it's a very thorough process that follows well written ethical and legal framework here in America. So it was interesting for me to research this topic.
Yeah.
So I'm going to ask you one question,
Mhm.
and the question is this: what would you, in this area, in Philly, there are a lot of immigrants, right? And there are people
Mhm.
coming from all over the globe. And a lot of them are not really so familiar, because they may be coming from countries maybe where their healthcare systems are not so advanced. So what would you say to someone who maybe, okay, they've heard about being registered as an organ donor, what would you say to them if they're thinking about signing up, but they're not sure, they don't know what their family is going to say, or maybe they've heard all kinds of different things and they don't feel so confident? What would you tell them?
Well, it's okay for someone to have reservations, particularly about something they may not be aware of. So, our first goal is to educate, to provide the information, to answer any and all questions, to address those concerns and sometimes misconceptions. So the first thing I would say, of course, is to make sure that this person or these persons are well educated and knowledgeable about their decision, right? And then, like we said earlier, have this conversation with your family. And then also, too, what I always say is that if you needed an organ transplant, would you accept it? Right?
Mhm.
So that is something, those are things that are really something to reflect about. But knowing, like we said earlier, that people of color are nearly 60% of people of color on that waiting list. And we're so underrepresented when it comes to actually registering to become an organ donor. And it's just really important that, we are able to give back to ourselves and to love thy neighbor, if you will. So I would say all of those things, but it's really important for us that people understand their choices, understand what they're doing, and certainly have a conversation with their loved ones about the decision that they made to register as an organ donor.
So you said in this area, right, in this particular region, there are about more than 60,000 people of color. So people of color referring to African American and Hispanic. And the reason is that, when people of color sign up, and then the organs, maybe, are they better matches maybe? Is that because people have to match based on so many criteria? And I understand that the waiting list, when I used to hear about, this wait list, I used to think it was just one long line and then you would start with the first person and go to number 2, number 3. But it's not so much like that. It's basically a pool of people that they categorize based on their age, their general health, and then the different factors in terms of blood group, their HLA type, and things like that. So can you talk a little bit more about the wait list and
Sure.
what it
So
means?
so there is a organization called UNOS, which in the United States is called United Network of Organ Sharing, which is a federal program that, as you already mentioned, pulls together all that information about folks who are, organ donors and people who are waiting. And so all those factors are put into place. And the importance or when someone is really in need to have one, could supersede someone else based on, how soon they need to have this life-saving organ. But the waiting list, when we talk about actually people who are actually on a waiting list for life-saving organs, the waiting list is so much more of people of color or non-white, if you will. And the thing that we always say is that, organs technically are colorblind, but the chances of a better match will be better with people from your own, ethnicity or culture, right? But it doesn't mean that an organ couldn't be matched with someone else of a different culture. It's just that there's a better match, less medication possibly, and all those things to consider when we talk about people on a waiting list. Weight is a factor, height, size, all those things. And it's just important, to bring it back that we are able to take care of ourselves and, ultimately with organ and tissue donation, what you're also doing is taking care of someone else as well.
This has been a really great discussion. I think we've touched on a lot of useful information. So I'm going to, I guess, round it up. I want to thank you, Leslie, for
Thank you,
coming
Dr.
on
Noah.
tonight. You're welcome.
Mhm.
And I want to thank the viewers for listening and watching. If you're on YouTube, if you're on the podcast, thank you so much for listening. I've mentioned the site. If you want to become an organ donor, to register, it is donors1.org.
Yes.
So thank you so much, Leslie. Was there anything else that you wanted to say before we wrap up?
Yes, to all the listeners out there, no matter where you're from, if you're not from the States, you can certainly research, what it means to be an organ donor, and particularly what it means to register to become an organ donor. And just remember that, you should take care of yourself always, have a conversation with your families always, and, help us save lives. So thank you.
Absolutely. Absolutely. So today we're talking to Leslie from Gift of Life Donor Program. It is August and it is the National Minority Donor Awareness Month. So if you've enjoyed listening to us or watching the YouTube program, don't forget to share this information with your friends. Start the conversation with your family. And subscribe to the program. Register. Thank you so much. I enjoyed this conversation.
So did I. Thank you.
All right.